Well, at 6 o'clock, we told you about a local doctor's office charging $90 for a COVID test the CDC says is misleading, Chris.
Kendall Ford went to the clinic to confront the doctor and get her side of the story.
The test they're offering is an antibody test done through a blood draw. They say it looks for an active COVID infection, but the doctors I spoke to say that's not how it works.
Do you guys do rapid COVID tests?
The answer was yes when we called the MedCare Center on 130th Street in Parma Heights. Their signs outside say they offer rapid COVID testing. Their website, however, calls their method rapid antibody testing. So we called to clarify.
I was a little confused on your website because it said it was a rapid antibody test, but it is just it is a rapid COVID test.
We asked to speak directly with the doctor in charge here. Instead, an office employee returned our call on Dr. Carmen Popa's behalf.
It does test to see if you have COVID currently, but it's the antibody test.
So your test shows if somebody does currently have it?
And also if you've had it before based on your body's antibodies, yes.
I couldn't taste or smell anything.
Problem is, 28-year-old Evan says he got a negative test here and went back to life as usual before getting a positive result days later from a swab test at Walgreens.
It was very upsetting to me because unfortunately I do know people at work, like 3 other people ended up getting it after I did, and it just makes me feel like I'm responsible and that I could have prevented it had I gotten like real results.
After multiple unreturned calls, I try walking into the office and asking to speak to Dr. Popa herself.
Hi, I'm Kendall Ford with Cleveland 19. I was here yesterday. I was hoping I could talk to Dr. Popa. I didn't hear back from her yesterday.
Dr. Popa wouldn't go on camera or explain why she advertises a rapid COVID test, but told me all the information on her website is accurate. She says patients like Evan could have been infected between the time he got his negative test results at her clinic and his positive test somewhere else, even though Evan says he was starting to feel better. Still, that doesn't explain patients like Jacqueline Bowen. She says she received a positive test before her negative test here.
And I was infuriated that they were not necessarily that they had a false negative, but the way that they administered the test, the way they described the test.
Dr. Danielle Rhodes with the Cleveland Clinic says the best way to get real results is an antigen test, usually done through a nasal swab. Far different from rapid antibody testing. Antibody testing, he says, only shows the virus after they've recovered or about a week after infection. And in some patients, it doesn't even appear then.
Detection of the antibody is evidence that somebody has been infected either in sometime in the distant past, or maybe is beginning to recover potentially, or their body is at least mounting an immune response to the virus.
Earlier this month, the FBI says agents raided a clinic in New Jersey, claiming to be testing for COVID using blood tests. The agency is saying in a release, quote, only a test that uses a nasal swab or saliva should be used to diagnose active cases of COVID-19. I asked the office about Evan's recent false negative test.
Is that made known to patients when they come in and they get their test?
Yes,
that they might, that even if they test negative, they could still have it?
Yes, and that is on the paperwork.
This paperwork, which Evan says is confusing at best, including a blurb about the test he took. At the top, it says he tested negative for a COVID rapid antibody test. He says he was provided the paper to give to his employer to return to work. Evan is just worried he's one of many who didn't understand the risk still at hand because of information he got here.
It makes me feel terrible as a person to think that I was going around and spreading this because I didn't think I had it, when in reality I did.
Kendall Forward, 19 News.
Now, this is a 2-part investigation. You can watch both of the segments on our 19 News app. You can get that on your phone through Apple TV, Roku, and Amazon Fire.